Today I'd like to spend a few minutes talking about how to resume an exercise program after you've had heart surgery. It's important to begin exercise immediately after heart surgery. The sooner you can get moving, the faster your recovery will be. Early on, when you're in the hospital or when you're at home for the first couple of weeks, just start out with short duration activity of maybe only 5 or 10 minutes that you'll do multiple times a day, somewhere around 4 to 6 times per day. As you're able to increase your endurance and walk longer intervals, you can then reduce the frequency. Eventually, you should be getting up to the point where you can walk comfortably for 20 to 30 minutes at least 1 time per day. Somewhere around 2 to 4 weeks after your discharge, it's time to enroll in a cardiac rehabilitation program. If you've had a heart stent, maybe only 1 to 2 weeks, it's time to enroll. If you've had an open chest procedure, probably somewhere around 4 weeks to begin your cardiac rehabilitation. If you've had more advanced procedures that have minimally invasive, like a TAVR, for example, you may be able to begin cardiac rehab in 2 to 3 weeks after discharge. At this point, your exercise will begin to advance a little bit more. The frequency of the exercise should be anywhere between 3 to as many as 6 times per week. And the duration of the exercise will start out with around 20 to 30 minutes, and every week or two add just a few minutes until you're able to get up to 40 or potentially 60 minutes of exercise. A lot of times the question is, well, how hard do I do the activity? Early on, if you haven't had an exercise stress test, you can simply go by how you're feeling. Exercise at a level where you feel like it's a light to maybe moderate exercise, where you do feel a little bit challenged breathing, but not so difficult that you cannot carry on a conversation with somebody. Another great way to establish how much exercise you should do is if you have an exercise stress test post-surgery, and then your exercise team and physicians can give you more specific parameters regarding what heart rates could be and right intensities based on your time in recovery. Some things to keep in mind is that there are factors that can affect your return to exercise. Certain medications can affect how your body responds, pain levels from surgery, fatigue levels from surgery, or even if you have any newly implanted devices like a pacemaker or an ICD, can all influence how to do your activity levels. There certainly are many, many benefits of participating in exercise after surgery by increasing your strength, increasing your stamina, reducing your risk of further cardiovascular disease through helping to lower cholesterol, blood pressure, blood sugar control, and start to improve your muscular strength. Some questions I do get are, when is it okay for me to start to resume resistance training exercises or strength training? Typically, if people have had open heart surgery, we ask them to wait about 8 weeks post-surgery to allow all the surgical sites to heal. At that point, it's okay to begin to re-engage with light exercises, activities that you can lift maybe 10 to 15 repetitions with very minimal discomfort in the muscles. And then each time try to add a little more resistance until you have more fatigue in the muscles around that 10 to 15 repetitions. This is an activity that you can do maybe 2 to 3 times per week, where your walking or aerobic exercise should be done almost daily. Other things to consider when you are re-engaging in your exercise program are what activities should you avoid. As I just mentioned, avoid lifting heavy activities early on. Avoid doing high-intensity exercises early on. Some things also to think about not doing are swimming. If you still have any open incisions or scabs, you do want to make sure those are all healed before you do any type of water exercises. There's also some leisure time activities that people like to get involved with, things like golf, things like tennis. And it's also a good idea to wait maybe about 6 to 8 weeks before re-engaging in those. And a great tip for starting off, if you are playing golf, just start using your putter. If you're not having any kind of surgical discomfort using your putter, next time move up to your short game and your chipping. If you're not having any difficulty doing that after a few sessions, you can move up to your driver. And as long as you're not experiencing any trouble, then feel free to enjoy your golf game again. Exercise, again, is very important to re-engage after open heart surgery. Slow, steady progress should be expected, and getting enrolled in a cardiac rehab program will give you the best outcomes in your exercise.